Hi, I'm Jess, Clinical Director at the Optimum Health Clinic, and in this video we're going to be thinking about interoception. What's interoception and what's it got to do with nervous system regulation and emotional health? Recent studies have found that interoceptive difficulties are linked to a variety of conditions, including anxiety, depression, neurodivergence, chronic pain, post-traumatic stress disorder, and chronic fatigue syndrome. So what is it? When it comes to the senses, we usually think of the 5 external senses, so sight, sound, touch, taste and smell. However, there's also your internal senses. These include a vestibular, proprioception and interoception. The vestibular system influences our balance and motion and works closely with our visual and auditory systems. Proprioception helps us understand our body position, levels of force required and how to coordinate movement. Examples of proprioception include our ability to touch our nose with our eyes closed, know how much pressure to apply when writing, and knowing what kind of surface you're standing on without even looking. Interoception, which we're talking about more in this video, gives us feedback on our internal physical and emotional states, such as hunger, thirst, tiredness, sadness, safety, and boredom. It describes our awareness of our internal states, how we interpret these sensations, and whether we're able to act appropriately to self-regulate. So what do we mean when we talk about interoceptive difficulties? When it comes to interoceptive awareness, we often describe people as being either hyper or hypo-aware. That means you can be highly sensitive to your internal signals, so hyper-aware, or have reduced sensitivity to them, which would be hypo-aware. When we're very sensitive to the body signals, they can become distracting or induce anxiety. You might constantly have the urge to use the bathroom, or you might experience really heightened intense emotions. For some people, they can notice these sensations in their body, but they're not able to discriminate what the sensation means, which adds more difficulty. On the other hand, when we have a reduced level of sensitivity, we don't always recognise that our body is trying to tell us something. This may mean you're less likely to notice when you're hungry or thirsty. You might not notice pain signals or have trouble feeling emotions, or you don't even recognise when you need to go to the toilet. Being hypo or hyper-aware can have a huge impact on our health and well-being, which is why it's important to bring awareness to our interoceptive function. There are a few different ways you can help bring more awareness to your interoceptive function. Here are some of the things that I encourage you to try. First of all, body scans. So body scan meditation is a mindfulness practice that involves focusing your attention on different parts of your body. It can really help you become more aware of your body sensations and help you to relieve tension. Next one I encourage is meditation. This can help by creating a practice of regularly stepping back from the day-to-day noise of thinking and doing, and instead just notice. Notice thoughts, notice the breath, notice sensations, and drop the struggle to change any of these things. We also encourage check-ins. So creating many moments in each day when you pause, tune into what's going on inside your body, to help you to notice, identify and respond, and thus self-regulate. Asking yourself the question, what do I need right now? And allowing your body to answer, it might be food, a drink, a hug, a movement, a rest or something else, really helps. The additional challenge here is that in order to be able to notice, identify and respond to the interoceptive message, you need to have the capacity to do so. You need to remember to notice. And emotionally, you need to have enough emotional bandwidth or capacity to take the time. For people who are neurodivergent or suffering from energy-limiting conditions, all of their energy may have been used up trying to focus at school or manage the tasks of daily living, and so they just don't have the capacity left to be able to self-regulate. So we work with people to support them, to recognise that at least 1 unit of energy every day is needed for regulation. And when they use energy in this way, with regular check-ins, body scans, meditations, they're actually investing in creating more energy for the next day. And a body and mind in balance uses less energy than a dysregulated one. If you'd like to find out more about how we can help you and your interoception, then visit the Optimum Health Clinic website and book a discovery call.